So let's get started. The government shutdown has now surpassed a month. The crunch of no federal funding is now being felt by many aid programs, notably SNAP. Just before this show's taping on Friday, a federal judge ruled that the Trump administration must tap into emergency funding to maintain SNAP during the shutdown. Last week on this program, we debated the stakes of the food program's funding, and I invite you to check out that discussion. This morning, we're diving into the issue at the root of the shutdown. This month also marks open enrollment, and Democrats have warned that without an extension of Affordable Care Act tax credits, healthcare premiums will climb dramatically. Republicans argue the cost is excessive and that the system itself needs reform. This week, Congressman Morgan McGarvey and Governor Andy Beshear held a media briefing with a constituent bracing for the sticker shock.
Without that tax credit, our current monthly premium is $1,275. So that's an increase of over $900 a month. We do not currently have an extra $900 a month in our budget.
I think if you legalize the ability to bargain collectively for the consumer, you would probably have Amazon selling insurance, you'd probably have Costco, Sam's Club, Walmart. These entities would come together and they would have the power of this large size to literally negotiate down prices.
In an interview this week, Senator Rand Paul told me he's proposing a bipartisan commission to look at options for keeping healthcare costs low in exchange for reopening the government. So, Senator Berg, I want to start with you here. Paul is just, one voice of many in the Republican Party on this. How feasible is what he is proposing versus what Democrats are asking for here?
Well, what the Democrats are asking for right now is just an extension of the subsidies that were put into the Affordable Care Act back in, I think it was 2021. For example, my daughter pays $256 a month now on the Affordable Care Act. Her premium will go up to over $500 a month. Nationwide, they're saying that premiums, if this doesn't get fixed, that premiums will go up 114%. And what that means, it just means that people can't afford health insurance. And it means they quit trying to afford health insurance. And what that means is that the hospitals no longer get paid. They still have to do the work because people still get sick, but there will be no insurance to cover these people. There will be no way for them to recoup their costs, and that's why we're looking at losing potentially 35 hospitals in this state alone if this is not fixed and fixed soon. People think that people are out there getting something for nothing. That's not the truth. Medicaid covers 50% of the children in this state. 1/2 of the children in this state are covered with Medicaid. 70% of our nursing home residents have their beds paid for by Medicaid. What this one big, beautiful bill does is transfers $900 billion worth of healthcare costs from the federal government to the state governments over the process of 10 years with no alteration in tax structure.
So I don't want to cut you off here, but let's bring in Senator Webb for another side of this discussion. How do you see things here?
Well, it's a complex issue, not only the human side of it, but also the political side. There's a rich history from like 2017, and I think you'll have more discussion based on history and the party's positions and the fallout, potential fallout in this case. But Senator Berg makes some good points. If you're from a rural area and you have a rural hospital, and your population is overwhelmingly dependent, it certainly raises a red flag. It needs to be discussed. I think Senator Paul is on the right track. I think the markets need to be opened. It needs to be reviewed. The whole system. It's not just that portion of funding. It's the whole system. And if you look at it from a global view, and from a market view. And I think that will, I hate to study things too much, but this is one that really has human and physical impact that I think everybody wants to resolve.
I know that we could probably unpack the healthcare discussion for over an hour here. I'm going to let you respond real quick, but we got about a minute left here, and just want to close the discussion asking, if these subsidies expire, not just for ACA folks, but for people like me, I get my healthcare, through my employer, right here at work. Why is my healthcare going to go up?
Well, that's the actuarial tables and how insurance works. If you take the healthiest people out of the market, and that's what's going to be happening, because like in my family, my niece, her husband owns his own business. She's a social worker. They have 3 children. The insurance her work offers costs the family like $800 a month. $9,000 annual deductible. As a family, this is an educated family, they have just decided not to carry insurance anymore. When we have the young, healthy people leave the market, remember, 90% of healthcare costs are spent in the last 2 years of somebody's life. That's how our healthcare works right now. 90% spent in the last 2 years. If we only have the old and the sick in the insurance pool, then the insurance pool can't cover it.
All right. I hate to cut you off here because I know there's a lot more we could discuss on this one.